Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on COVID-19 in the Appalachian Highlands for the week of June 21st, 2020. As you know, I like to follow deaths per million, so if you go to Worldometer and hit the US, and then all 50 states will appear and you hit deaths per million. When we started this several months ago, as I pointed out before, Virginia and Tennessee were vanishingly small compared to New York and New Jersey and Connecticut. Over time, those numbers have grown fairly consistently, such that by this week, we've seen a pretty significant increase in both Virginia and in Tennessee. But what's interesting is I showed you before that cumulative deaths per million in the US went up quickly in the beginning and then started slowing down and went up 3.9% last week. If you look at Virginia, it's interesting. They had pretty much the same pattern. They were growing much more quickly in the beginning, but then slowed down fairly quickly. And interestingly, the last week had exactly the same growth rate. So now it looks like Virginia may be paralleling the rest of the United States. Tennessee, on the other hand, has had a little bit of a different pattern. They started growing and then they were slowing down a little bit like we saw everywhere else. Then it jumped back up and slows down again. So whether, I suspect what this is, initially I thought this was just due to small numbers, but I think what's happening is there have been sub-outbreaks. Initially we saw an outbreak in Nashville, and now we're seeing one in Shelby County. So we'll have to follow this over time. Hopefully we'll see the percent death rates continue to come down. I did find this interesting statistic. This is hospitalizations in Tennessee. And what you can see is for the last 4 weeks, there's been a pretty stable number of hospitalizations. So even if there's some up and down, the overall impact on the state seems to be staying about the same, but definitely something worth following over time. To date, Tennessee has reported 34,000 confirmed cases and 500 deaths, mostly but not exclusively in the large metropolitan areas. Virginia has had almost 60,000 cases and 3 times as many deaths as the US. And again, largely in the northern and urban areas. And then our region has had about 1/10 the number of cases that Virginia's had and about 1/10 the number of deaths. This is a map of the deaths, and you can see that they're mostly clustered in the urban areas of North Carolina, but with scattering in other places. So just as we are seeing in the rest of the US, we have an evolving pandemic here in the Appalachian Highlands. We want to definitely keep track of it and make sure that we don't see any changes over time. If you'd like more information on COVID-19, go to the College of Public Health website, where you can click on this icon and see a number of short videos on this topic. Thank you very much. If you have any questions, let me know. I'd be happy to try to find an answer. Thank you.